Welcome students. Research, key to evidence-based science, is the key for us to launch this course of orientation course in research methodology by the SOUKYA Foundation. We are immensely proud and happy to open this to all Ayush system of doctors so that they explore into the area of research. Today, evidence-based reaches the public and they understand the way these systems work. The key to that is research. Therefore, SOUKYA Foundation took this as an initiative to get the Ayush system of doctors be aware and get into the system of research. Basically, going through our own work, we decided that Ayush system of doctors, when aware of the research procedures, can showcase them very well. For example, a doctor who has got good evidence-based study in case of an ulcerative colitis, in case of a spirometry study in asthma, is not knowing how to take this further. To us, the word research means a lot of work, big lab, a huge amount of money, and so many, a huge staff, and so many such things. In the reality, that is not needed. SOUKYA Foundation, with its association with international and national various research organizations, understood what we need are good evidence base, good doctors, good amount of good case studies. With that, each of us, each of the Ayush doctor are capable of doing a research program. With this in our minds, Dr. Matai, our managing trustee of SOUKYA Foundation, Mrs. Suja Isaac, trustee of SOUKYA Foundation, decided to launch a series of courses in research methodology. I would be taking you on a journey of the first of its kind, as we name it as orientation course in research methodology. This program is a very interactive program. We have designed this program to be over a period of 6 months. This is online. The module is available on the online, and the hard copy, the printed copy of the module will also be available with you. So the doctor, whenever he or she finds the time, can go through the subject. There are 6 modules for the 6 months. First module should be taken over the first month, and in the last week we will inform you the date of the examination. This examination is again an online examination. You will be given a specific time and you will be given a 30 objective question on the module which you have studied. This will be followed by 2 detailed answers. This examination part has a limited time and will expire, but your module is available to you throughout the entire course. What I mean by this is, if you would like to go back to your first module, even while you are at the third module, you can come back and it is still available for you to go through. You clear this examination. Once you clear, the concerned faculty member goes through your paper and will evaluate, and you will be told about your results. During the entire month, when you are studying the module, you can refer to other books, you can come with your queries, you can value add to this what we are providing. We are creating a platform where there will be an email ID provided to you. What you have to do is, you have to write your mail with the query or with your doubts, and we will facilitate interaction with the professor so you can get your answers. As many senior doctors are students in this program, we welcome their suggestions and opinion. The coordinator would be following this up and will be replying to you. If there is no reply in 24 hours, we are providing you with a telephone number where you can contact. This is basically, as I earlier told, to make it interactive and to also clarify all your doubts and to make this course give you a result. Further, there would be 2 contact programs scheduled on May and September. We will be communicating with you well in advance. You will have to make your own arrangements to attend the 3-day contact program, which will be conducted at our Center of Excellence. Any support needed for your stay will be assisted by our office. During the contact program, you will be personally interacting. So the idea of keeping a contact program in the May is to familiarize, and by September, as experts, we will be demanding for more and looking for learning more information. Or I would say towards the second contact program, we would be more equipped to ask our professors all our doubts and be ready to get into our project phase. The last part of the module or the last part of this entire program, we have a very nice thing happening. All the students are requested to design a protocol and submit a research program. Please don't think it's not possible. It had been possible to SOUKYA team, and I'm sure you're all going to come out with wonderful designed research protocols. The best of the research protocol will be given an award, and Dr. Isaac Mathai has made one more announcement for 3 of the protocols. The best of the protocols will be given a Best Protocol Award. Further, we would like to say SOUKYA Foundation will be choosing 3 of the research protocols, and we would be more than happy to be the facilitator to connect your research work with the concerned research agencies like CCRH, CRF or other research agencies. Yes, it is very exciting to get on and start studying. Now, coming to the modules. The modules are, we are looking up as the first module as just introduction for all that we are going to take you through. In this course, we have planned 2 contact programs. The 2 contact programs would be conducted on May 31st, June 1st and June 2nd. This is the first session. The second contact program would be conducted on September 13th, 14th and 15th. It will be conducted at the Center of Excellence in Bangalore. I would like you to look into what are the modules and how we are going to take this forward. The first module is an introduction. We are doing an introduction into research methodology, research biostatistics, research epidemiology and the research process with the research healthcare issues. Module 2, we are addressing the actual research processes. With the module 3, we are taking you into the detailed epidemiology and biostatistics. Ayush doctors, when it comes to the sample study, have a lot of challenges to face. So in addition to an expert statistician, we will be providing you a hands-on support as to how to arrive at a good sample study. The next module, we will take you into research documentation. Why documentation? This is a very critical and crucial aspect of the research processes, and it is very well formulated. So a student learning the process of documentation will be able to get into the protocol design very comfortably. Followed by this, our next important aspect of a research, which is ethic, is being dealt with. So the next module is research regulations. We all know, we all have heard about ethics, but research looks into this as the vital or the most important part when we publish our study. This has been given a very good exposure in our course by an expert who will take you through this module. We know about how to design, we know what is the process, we know how to document, we also are aware what are the ethics involved with it. So now what we need is a study of how a research methodology or protocol designing is happening. So now what we need is a study of how to design a protocol. Along with this, we also need to know what is the status of research in healthcare. The last module will address the status of research in healthcare, which will guide us as to how we can plan our own, and will also support you in preparing your research protocol. I am sure all the doctors would be having their own special successful stories, whether it is a sinus case, whether it is an ulcerative colitis or whatever. So start collecting the cases in detail by the time you finish your course. Why I am telling this is, when you are designing a protocol, you should have confidently cleared a condition with a certain remedy using a certain protocol. So as the modules progress in the 6 months, please get back to your clinical study, what you have done, get back to the gold mine you have, collect the data, and with the support of this entire program, come out with the most wonderful research protocol of your own. Here we are also providing you a platform of taking extra support from us through email communication. During the entire program, you can communicate with us, and if you do not hear from us, we are also providing you a phone number, and our coordinator will be available to talk to you. Senior doctors, young doctors, fresh graduates, let's all gear up to a wonderful orientation or glimpse into the world of research, which is never-endingly fascinating. We went through the journey of how we are going to do the course. Now I would like to give you a brief on how we started the journey. The journey started by establishing the SOUKYA Foundation Charitable Trust. SOUKYA Foundation, run by Dr. Isaac Mathai and his wife Mrs. Suja Isaac, is into patient care, work in villages. The focus here is mainly patient care through our 3 charitable clinics, 5 free clinics, various camps. The other aspect of SOUKYA Foundation is to create awareness. We have successfully conducted seminars, camps, and the USP here had been continuous medical education. Continuous medical education, which is the key which allows any doctor to grow, had been one of the strengths at SOUKYA Foundation. With these activities, SOUKYA Foundation was recognized as a center of excellence in homeopathy for respiratory diseases. It was a momentous occasion. Various eminent doctors visited our various clinics, went through the records which had been maintained over 20 years, and finally from the Government of India, Department of Ayush, we were awarded the Center of Excellence. This gave an initiative to do various work in the area of respiratory medicine. With this initiative, we are very proud to say we have dedicated clinics on asthma and allergy, COPD, which is chronic obstructive pulmonary disorder, and sinusitis clinics. Why dedicated clinics? It enhances and gives specialized attention to these chronic conditions, and the results are amazing. In addition, we have the state-of-art respiratory laboratory, which has about 4 spirometers and the DLCO, which is the ultimate equipment to measure the total lung capacity. DLCO is diffuse lung carbon monoxide measuring equipment. Armed with this, we were prepared to showcase that the system effectively treats conditions like asthma and allergy, and we have evidence-based proof in the documentation. This led to few of interesting studies by SOUKYA Foundation. With NIMANS in homeopathy, we worked on a program for de-addiction using homeopathic medicines. The results show a positive trend. Followed by this, we have few more work done at the Center of Excellence. Some of them are a study on asthma and allergy using spirometry. We used spirometry study after giving homeopathic medicine and understood the bronchodilatory effect of the homeopathic remedies. No study cannot be complete without reaching patients suffering a particular problem due to a particular exposure. Today's modern age, KSRTC was one such chosen area for us to study on the effect of pollution on the breathing. We had a very interesting study done in KSRTC drivers, conductors, mechanics. The result was the mechanics and the office people in the KSRTC building had equal suffering as much as the drivers. We plan to take this study further to the entire KSRTC employees. Another area of interest is pediatrics and its colds and coughs. Every pediatrician is bombarded with a mother who is tired of the colds and coughs suffered by her little ones. The way the homeopathic medicines worked on the immunity to prevent colds and coughs was studied at our free clinic at Crystal House. This is a school of international standards run for slum children. We did a study, and the significant finding here was there was reduced absenteeism. Therefore, the children studied better and the results were amazing. So we had the pollution affected people's results. We had the way the immunity improved in pediatrics, and we looked back, we took up the 2,500 cases where respiratory conditions of colds and coughs were treated at our clinics. This retrospective study gave us a very interesting information of the successful treatment using medicines like Hepasulf, Bryonia, Sulfur, Calcarea Car, Silicea, Natrum Sulf and Kalium Carbonicum. These are some of the studies which has made us understand that we can take our approach, our treatment success to a different level. So currently we have launched a protocol on understanding the effectiveness in acute bronchial asthma. This is a study for a year where we are understanding what are the changes in the various climatic changes in Bangalore. Now you can see that these interesting studies made us request Dr. Mathai to take us to a proper course material, and I can say this is how the birth of the course happened. Our other aspects of work in the field of Ayurveda and naturopathy led us also to interesting informations. So to take up studies in the system of Ayurveda, to take up study in the system of naturopathy, we thought we should open this to all Ayush doctors. All of us are equipped with a lot of information. Now we would streamline it. So this is what has happened at the Center of Excellence, which is part of SOUKYA Foundation. The larger aspect of SOUKYA Foundation, which is addressing integrative medicine, where under the umbrella of allopathy, Ayurveda, naturopathy, homeopathy, Unani, Siddha has one goal, which is ultimately take care of your patient. As we do it successfully, we thought we will also showcase it to the scientific world. I now come to the conclusion of my introduction to the course by thanking to all the very important, significant, eminent people who contributed to our works. We would like to thank Dr. Peter Fisher, a world-renowned scientist in the field of homeopathy. He is the clinical director of the Royal London Homeopathic Hospital. We would like to thank Dr. Sundeep Salvi, who is the director of the Chest Research Foundation, and we would like to thank Dr. Sneha Limaye, who is the clinical head of the Chest Research Foundation. Their support had been continuous, and we would like to thank Sri Hamid for initiating the process through the Chest Research Foundation. We would like to thank Dr. Manchanda, the Director General of the Central Council of Research in Homeopathy, who believes much work and need of the hour for homeopathy in various areas. His energy is immense and he's unconditionally provided his support. Further support we have been getting from all officers of the Central Council of Research in Homeopathy, and a special mention of Dr. Kurana, who is the Deputy Director, is to be thanked immensely. We would also like to thank Dr. Ishwara Das, who is a very special person for our foundation. He is the retired advisor to the Government of India, Department of Ayush, a renowned homeopath and a visionary. Where there is good homeopathy, he is there to support. We would like to thank Dr. Ravi Narayana. Dr. Ravi Narayanan from the Public Health Foundation, who is now in an advisory role, is the father to develop public health, and his keen interest to the Ayurvedic systems of medicine has been a great help to all of us. He and his associate Dr. Mohammed had been supporting us in this venture. We would like to thank them. Dr. Paramesh from Vivek Foundation and his associate Mr. Vairamuthu, we would like to thank, as they are helping us in establishing or in making the research program happen. A special thanks to Dr. Munir from the Rajiv Gandhi University. He is a director in the Rajiv Gandhi University. His vision, his work in coordination of the modules is the backbone of our course. We would like to thank him.